Hi, my name is Francine and I have ovarian cancer. We don't know how long I have, so my job right now is to make every day count. Hi, everybody. I hope you're all doing well. Today's topic is kind of a rough one. As you know, if you've been watching my channel, that I have terminal cancer, and I wanted to address cats. I don't want to address cats, but they're a little wild today, so I will insert a video or something.
Ooh. Oh, man.
I wanted to talk about when to decide that you don't want cancer treatments anymore. And I will start, I guess, with my story, because there's a lot of reasons to decide on that. And it's a very personal decision. I mean, you should start a conversation before you just decide. I think that's very important, that there could be angles you hadn't thought of. And I'll talk to you about that in a little bit. So if you're struggling with this decision, watch till the end. I was diagnosed in early 2023, about 2 years ago now, this month or last month. And at this point, 2 years ago, I was in chemotherapy. And it just didn't work. So the oncologist, before the chemo started, had said surgery probably is not a good idea because you have a lot of scar tissue. So I don't know how successful that would be. So when the chemotherapy didn't work, she put the surgery back on the table. So I wasn't all that hopeful about it. And I had been considering it the entire time, the what ifs. What if, the surgery doesn't work either? And I also have a video called Terminal. When I was diagnosed, it was in the hospital, and I didn't have a lot of viewers back then, so I'm going to link it up here. So we had that discussion, and it was terminal, but she had other options. She had medications that, may shrink tumors. Some people with my cancer, low-grade serous ovarian cancer, it has been effective for some, not effective for everybody, but chemo agent pills come with a lot of side effects. And in fact, there were more side effects than, let's just say she had to take me off of those medications. So you really want to look up any chemo agent that you take orally, even just for maintenance. You probably want to look that up. So it was actually dangerous for me to stay on that medication. So she offered me another one, which I did some research on, and I was like, no, I don't want those side effects either. So, and so I won't list all of those. I think I have them in a different video if you look back in the archives. So my decision to stop treatment was really about quality of life. I felt like I beat my body up enough for nothing. And I didn't want to spend my remaining days fighting. There's nothing to fight. For me, it was more about making peace, accepting it, making room for it. I'm not really sure, but it was here and I accepted that it was going to stay. So one of my other oncologists up in Vermont had, do you need to do Zoomies right now? Oh my goodness. the oncologist in Vermont had said, listen, we know what we ask our patients to do. And I will support whatever you want because we know it's difficult. It's very difficult. If I had a glimmer of hope, I certainly would have chosen to keep going. And even though I decided to stop all treatments for the quality of life that I enjoy, and not that everything is awesome, but it's certainly better than, trying a new chemotherapy or a different surgery, and if I was younger and I hadn't lived my life, if I had everything in front of me, yeah, I would keep going for sure. And especially if I had little children, but it's a personal decision. And I still, stand by my decision. I have no regrets on that. However, if a clinical trial came about, if the NIH is still, intact and not already dismantled, okay, that's another soapbox. But if that cancer research is available and there is something effective for me to try, I will. So it's not a matter of giving up. I don't think you give up when you do this. When you make this decision, you're just choosing quality of life. I mean, if I'm going to go at a certain time in the not too distant future, I don't want to miss out on this time that I have with friends and family and doing videos or doing things that I enjoy, that if I'm sick the entire time, then I'm going to be most likely laying in bed and not enjoying life. Now, I still have to manage symptoms, and there's still plenty of suffering that I go through. And if I'm having a bad day, then I don't make a video. So sometimes I upload on a Friday, sometimes a Sunday, sometimes a Saturday. I try to keep it to the weekends. But if I have a video in the bank, I may not be editing it. When I wake up, I'm like, no, not today. I try to give you the best of me because I'm here to offer support. I'm here to offer information and keep you updated. So if I'm just laying in bed, I don't really feel like doing that either. So that is my decision. And I do keep my options open. And I don't need anybody to mention ivermectin. I mean, there's nothing I haven't researched. Okay, let's just put it that way. So I leave a lot up to God. And, well, I have to leave it all up to God, obviously. But leaving it up to God for me to make, the best choices I can for myself. And I respect anybody's decision to stop treatment or to keep going. And that's nobody's place to judge that. I just hate watching people suffer, obviously. So turning it around as far as like maybe that's your time to make that decision. I did find an article written by Stephanie Booth, and I'm just going to read a couple of paragraphs of it because, it isn't necessary to go through the whole thing. So the article is called Deciding to Stop Cancer Treatment. She writes, your cancer treatment involves a lot of complex decisions. Sure does. The most challenging one may be when to stop. We all know in our heads that nobody gets out of life alive. Yet in our hearts, we retain the optimism that we might just be the first, says Brian Madden, MD, Medical Director of Palliative Care at Providence St. John's Center in California. The decision to stop treatment and accept this inevitability is when one loses that optimism. Beyond the obvious sadness this decision brings, I have also seen patients for whom it brought a sense of relief. I think that was me. I think it really did. It just let all the air out, I guess, if that makes sense. I was not doing this for everyone else, but I kind of knew where this was going. And even the chemo agent pill that I talked about earlier, tramitinib, that I think the brand name was Mechanist. That treatment was kind of from my oncologist. I mean, I took what she said to heart. That she was hopeful, clearly, and I didn't want to stop necessarily, and it sounded promising. And who knows if those side effects had not been a problem. I mean, even my face swelled up on one side and I had to go for an MRI because, we were afraid maybe I had a stroke. Fortunately, I did not, and the swelling went down after I stopped the medication. But there were a lot of things. There were uncomfortable things, and I couldn't see myself doing that indefinitely because, if the pill is working, you need to stay on it, right? So I think I did that for her. So she goes on to say, if you are at a crossroads in your cancer treatment, you should know that the decision to stop treatment is yours alone. There are many valid reasons to make this choice. Reasons to stop treatment. Cancer treatment is intense on purpose. Doctors use every tool they have to get rid of it, or at least control your cancer. But choosing to stop treatment isn't the same as giving up. Deciding to stop treatment when it may be causing more harm or suffering than good is incredibly courageous, says Dr. Baylor, MD, a psychiatrist at Memorial Sloan Kettering in New York City. Some reasons why you might consider stopping include your cancer is advanced and further treatment won't make a big difference in how you live. That is totally true. I don't think mine was that advanced. It's just not responding. And maybe we'll find something that it will respond to. Number 2, you've tried multiple treatments that haven't worked. Okay, yes, that's me. And number 3, the risks or side effects of treatment outweigh the benefits. Yeah, that's a little bit me too. If any of these apply to you, you may decide to focus on being comfortable and enjoying the time that you have. So where I'm blessed is that the doctor really couldn't tell me how long I had if I was not taking treatments. And I'm still here and I'm still enjoying my time. Like I said, it's a little limited, but the joy I find certainly now is much deeper than the alternative as far as being on treatments. In fact, I do try to make every day count, even on a sick day. Some days don't count because I don't feel well. Lately, I've been having a good run and many, many good days in a row with but I go through that. I can go maybe a month and not have to take a Zofran for nausea. And then I've got to take one every 12 hours for, 2 weeks. So it's very random. It's very intermittent. But I would say that this decision so far has been working for me. And I don't have any regrets. And I'm still holding out for miracles. But if it's not meant for me, then I'm just enjoying this time as much as I can. So I got to work on a new bucket list, though, because I feel like I could be here for another year. I could be here for maybe 2 years. I don't know much further out than that, but I'm definitely open and willing. All right. So, and then finally, I just wanted to mention that if you were struggling with this or your treatments are not working or for whatever reason you're considering just stopping, the first thing I would recommend is that you talk to your doctor, talk to your family, talk to your friends about what you're struggling with, because even though it's your decision alone, They may be able to give you some insights or input or things you didn't even think about. Maybe the doctor has another treatment idea that wouldn't be too invasive. So there are certain questions you definitely want to ask your doctor, like, what their opinion is. They don't dole those opinions out easily, but if they really feel like it's not going to help, then they are going to be honest. If you only have 3 to 6 months, cats, it doesn't matter what room I'm in, but so your doctor will be honest about the time that they think you have, if they know. I think a doctor that would give you false hope, I don't think that would be very cool. I would not call that a good doctor. I would call that a coward. Because part of the entire experience is being honest and trusting. And you've got to trust what they say, and they should be forthright. And they can have the good sense to have bedside manners, but I would always want to know the truth. So the truth for me was we didn't exactly know how long it would be. It would really be up to the tumors to decide how fast they're going to grow. And if they have been slowly growing for, 20 years, maybe from one cell that was left in my body, it took that long for it to finally show up on a scan. Now they do show up. It's just that there's a whole lot more in there than actually shows up in the imaging, but another video, and probably have already talked about that ad nauseum. So certain questions you want to ask: how your cancer is responding or not responding to the treatments. What is the outlook for your health if you go ahead with treatment? And what do you predict would happen with your health if you stopped? If you stop treatment, what can you expect in terms of symptoms and quality of life? And then finally, what is the treatment for your symptoms if you stop your treatments? And that would be a referral to palliative care. And if you do decide to stop, I made certain arrangements just because if I got sick suddenly, I wanted certain things in place. The final arrangements haven't actually been made. I feel like that's giving in for me, that's just, okay, this is it. When in fact, something could happen, I suppose, in my favor. But certain things you do want to get into place. You have to decide what's important to you. Whether that is getting rid of stuff you don't need and taking it to Goodwill, or if it is just think about everyone else around you and what they're going to have to do, when you leave. So I tried to make it as easy as possible, but I'm still a consumer and I still consume. And there are more things accumulating in the house, but I really try to be mindful not to keep a lot of stuff that, I'm not going to need when I leave and nobody else is going to want. So as I was saying, if you're struggling with this, definitely talk to people. The people, at least in your circle, as far as the cancer, you don't need to talk to it at the grocery store clerk, but just keep this in mind. Everyone has your best interest at heart. However, when you speak to family or people that love you and don't want to see you leave, they may be giving you advice from their ego, from their fear of losing you. You're going to have to discern the difference. If everybody says one thing and one person says the other, 9 times out of 10, it's because they're fearing that loss and grief. So they're already in anticipatory grief. So be sure that you kind of see those angles. You have to sort of open your third eye or your sixth chakra and really be able to see beyond the words sometimes. So, I'm hoping that nobody is actually going through this that's watching right now, but we all go through stuff. And if you have cancer and you're in treatments, I'm hoping that this video doesn't mean squat to you. I hope that you just get through your treatments and one and done. You couldn't ask for better, right? But if you've already had one type of treatment and it didn't work, but you've got hope for the next one, keep going, because there will always be time to make that decision. And you'll know when that decision should be made. Don't jump in haste. Just understand that, there are treatments that you'll respond to that maybe somebody else didn't respond to. I would also just suggest, while you're in any kind of treatments, to take good care of yourself, your mind, your body, and your spirit. Eat well, rest well. I mean, there are things that can work in your favor, and it helps you with side effects, and it helps you in your final recovery. So what you do right now is what comes back at you. So if it's all good, it's all good. Okay, if you're here and we're at the end of the video, I want you to but I want you to comment. I want to know if you're going through cancer, if you are terminal, where you are in this journey. And I want everyone else to read the comments and support. Let's support each other. Let's start a little support group in the descriptions below. It's one of my biggest aims is to understand that we have a community here. And that's another reason I feel very blessed to feel okay, is so that I can offer that platform. When I start doing videos in bed, I'm probably more apt to just give you health updates and talk about silly stuff, All right, listen, I love you all. I want you to all be well. I want you to take good care of yourself. And I will see you in the next video. Be blessed. Bye.